Welcome to Prevention 101, a five-part series exploring the foundational principles of substance misuse prevention on college campuses. This series is brought to you by the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery through The Ohio State University. Module 1 features Dr. Jim Lang, the Executive Director of the Higher Education Center, who will explore an introduction to prevention, considering a comprehensive approach. Dr. Jim Lang serves as the Executive Director for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, as well as the Coordinator of Alcohol and Other Drug Initiatives for San Diego State University. He has also served SDSU as their first Director of the Standalone Health Promotion Department. His research and service career have earned him an international reputation within the field of alcohol and other drug misuse prevention. In 2014 and 2015, he was awarded the California State Chancellor's Award for his service towards statewide progress in alcohol and other drug prevention. Dr. Lang was selected by the National Institute of Health to be one of 5 research scientists funded to facilitate their multi-campus rapid response to college binge drinking initiative. From his various research grants, Dr. Lang has authored over 60 scientific publications that have been cited within more than 2,700 publications. A number of his studies have been featured in major news outlets, and his study documenting salvia divinorum's effects through analysis of YouTube videos earned him recognition by Wired UK magazine's feature 25 Big Ideas for 2011 and the BBC Radio 4. Dr. Lang advised or currently assists several state and federal efforts, including California State Prescription Drug Task Force, San Diego County Alcohol Policy Panel, and RAD, the entertainment industry's voice for road safety. A San Diego native, Dr. Lang received his undergraduate education at Pitzer College and his doctorate education at the University of Maryland College Park. Before coming to SDSU in 2001, he was a senior research scientist with the Pacific Institute for Research and Evaluation.
Well, thank you, and welcome to these education modules designed to give you an overview of prevention strategies on college campuses. One of the things that you may be thinking as you go into the field of prevention on a college campus is that this is an overwhelming problem. There are so many ways of looking at the issues involved in alcohol and other drugs misuse on a college campus. You can think of it at various levels of the population, like the individuals or subgroups within a campus. Maybe you're thinking of it from a campus-wide perspective, but there's also the community perspective to think about and how your campus interacts with the community and how alcohol and drugs are porous within the community and the campus. You could start thinking about this problem along the lines of the actual substances, and there's many substances that are misused on campus. Alcohol is by far the most common. Marijuana is also prevalent on many campuses. But then there's the other illicit drugs, and those vary widely. There's also medication misuse, both prescription and over-the-counter. And then there's the class of drugs that we sometimes refer to as emerging, or ones that come and go a bit as they're developed either as a designer drug or become fashionable, and those start causing concern, get addressed, and then another one comes along. There's also different levels of misuse that you might be concerned about. There's the types of misuse that happen from usually some sort of overconsumption and the impairments that are caused by that. That's certainly the case with alcohol, where it can the actual intoxication is a major problem for a lot of students on college campuses and the community that are around the campus. But then there's also overdose, and or sometimes with alcohol it's called alcohol poisoning, and responses to that. There's also problematic regular use that may be occurring, either of a particular substance or a combination of substances. And of course there's substance use disorders, addiction, and recovery, and students who are in recovery and the support that you could provide them. And then moving beyond the actual substance and the subgroups, there's directly the consequences. And that's both in terms of the self and the community, concerns over academic consequences and ways to reduce those. There's, of course, physical, social, and emotional issues that get wrapped around the substance misuse. And the campus itself is impacted by substance use, alcohol, and drugs. And that can impact the reputation of the campus and its relationship with the community. And all of those things are wrapped into the topics that we're going to be covering in these modules. So when you start down this path, I want to encourage you to think about some principles of how to go about planning on the campus for how to do prevention, intervention, whatever it is your campus needs. The first is to come up with some way to objectively assess what the campus needs. So needs assessment is a pretty common first place to start. Understanding the prevalence of the various substances that may be misused, the harms associated with them. You may identify some target populations in the process of doing that, but then also looking for where can the interventions occur? Where do you have access to particular populations? And who can help provide that? Who are the partners that you can enlist? And also, where are going to be the barriers and the resistance to particular interventions that may emerge as you start looking at the needs? When you have done some of that first work, then comes the time to look for evidence-based approaches to addressing the particular needs that you've identified. A lot of times campuses feel they have to start from scratch, that they have to develop something local and with that's particular to their community. That may not be the case. It may be that you can find evidence-based programs because a lot of these problems have happened on other campuses and have been addressed, and sometimes they've been studied in a way that we can use the results to inform us on whether or not that's a good approach. So not starting from scratch is often a really good idea, because you may either be reinventing the wheel or you may be going down a path that's already been shown not to work. Adaptations of programs, of course, make sense as you think about your populations that you're serving. And then you would take your programs, and I encourage you to help the community of preventionists by testing the effectiveness and engaging the community with what you've learned. We are all benefiting from those who have taken seriously this topic from a scientific angle, so that we can learn from each other and continue to grow as a field. So in general, you can think of the various modules you'll be encountering as fitting within a comprehensive approach to prevention. And I sometimes call this a unified theory of prevention. And basically want to encourage you to just sort of imagine for a minute, not the alcohol and drug problems, but just a very simple physics problem. And that is, let's say a ball is rolling towards a target. How could you prevent that ball from hitting the target? And there's really only a few ways you can do that. One would be to put a barrier between where the ball's path is going and the target. And of course, what that would do is the ball would hit the barrier, all the energy of the ball would be absorbed, and there would be no more movement. And of course, you'd succeed in keeping the ball from hitting the target. Alternatively, you could redirect that inertia by deflecting it and making it miss the target. You could also imagine adding a different target that has some sort of attractive force, which would also allow the ball to continue rolling but miss the target. And third, you could actually put in some sort of counter force or remove the attractive force of the target and repel the ball away that way. So these have real world types of prevention pieces. And so the first, I'll talk about that blocking one. So what does that look like in a prevention rubric? Well, it's ways of keeping people away from the substance that we're trying to prevent. It could also be the behavior associated with the substance. So we can talk a little bit about drunk driving as an example, but first of all, let's think about the substance. So we put in policies, campus policies that restrict access to the substance. There may be substance-free residence halls. There may be maybe on a dry campus. There may be things put in place that keep the students away from it, and that can work to avoid misuse. It's also, of course, important not just to have policy, but actually have enforcement of the policy, because once, if it's not a meaningful policy, then it has much less impact on the actual access. So a lot of times prevention efforts are designed around how to increase enforcement or how to give the perception that enforcement has increased so that there's a greater sense of risk and cost to moving towards the target. But it also can be something less policy-based, and it could be things like responsible beverage service training, RBS training, which happens in bars and restaurants a lot of times, or special events service, with the idea that you're keeping people from drinking as much by having the server restrict access to overconsumption. This also could be an important part of resident advisor or resident assistant training so that they support the policies that might be restrictive. Within Deflect on campuses, that's often referred to as alternative parties, substance-free parties, things that, that students can do that allow them to do what they want to do, which is have social experiences, stay up late, do something new, all the things that are attractive to the social environment on a college campus, but in a substance-free environment. And so that allows the ball to continue to roll, but not towards environments that are heavy in alcohol or other drugs, but in something safer. This would also include safe ride programs and things like that, which allow people to engage in some level of use of the substances, but keeps them from the harms that would be in place if they were to do something like drunk driving. And so here again, this is sort of a different target. You're trying to change drunk driving as the target. You're trying to allow them to have the social and in some ways the substance experience, but keeping them away from the car. And then there's also just things that are in the environment that often we don't think of as behavioral alternatives, but really are. So, you know, the sporting events, the facilities, the rec center, that sort of thing are available. And finally, there's repel. And this is where a lot of our prevention efforts actually rest. This is trying to remove the attractive force or put in a repellent force. So from a substance perspective, this really is motivation. So we're trying to change the motivation of the student so that they're less likely to be attracted to using or misusing a substance and more likely to avoid that. And so this falls under lots of different types of programs. They could be just straight education programs. They could be part of counseling programs. It could be a social marketing campaign, various alcohol or other drug awareness events, sometimes guest speakers. Now, some of these have been demonstrated to successfully affect motivation and ultimately use and or harms associated with use, and some of these haven't. And so in the modules, you'll be exposed to various types of programs that that have been shown to show some promise. Now, all of these things fit within the community. The campus is not an island, although it often feels like it is when you're on the campus and when you're working there. And so thinking about where the community fits into any of these styles of prevention is very important. If you're trying to reduce access, for instance, and all you're doing is thinking about what's happening on your campus, and not across the street or in the hospitality zone that your students are going to, then you're probably just displacing the access to another location that maybe you don't have as much control over. So working with the community and trying to gain some control, in a sense, trying to instill responsible hospitality within the college bars, that sort of thing makes a lot of sense. So thinking about the whole community is important. It's also where you're going to find your law enforcement and possibly even looking for changing some local laws to help support your actions. And then finally, I like to make sure that I remind folks that research is really important. We started out talking about your needs assessment and understanding the problem, but then it's also testing whether or not your problems are being impacted by the prevention efforts you're putting in place. Is this a cost-effective way of doing it? Is it sustainable? All those things are part of research and should be within your planning. So together, these put in a comprehensive strategy. And so the modules you'll be seeing can help you fill in pieces of a comprehensive approach to prevention. It is true that the evidence base is a little bit stronger for some of these elements than others, but some of that has to do with the maturity of the research. So some types of programs have been studied more than others. And then some may just have broader or more measurable impacts, while others are really good supportive pieces and not necessarily something you would put as a main pillar of your prevention efforts. So the first steps that you're probably going to want to take is that assessing, understanding the problem. And so that could involve going to some standardized measures of your student alcohol and other drug use. So the first steps that you're probably going to want to take is that assessing, understanding the problem. And so that could involve going to some standardized measures of your student alcohol and other drug use. And so there's a few out there. This is some examples of some two widely used ones. ACHA has the National College Health Assessment. It's used on a lot of campuses. It's a broader measure. It doesn't just focus on alcohol and other drugs, which can be helpful because it can help bring in partners like your counseling center or your other aspects of student life. They may start getting excited about some of the findings within that as their strategic planning goes forward, and you can start building alcohol and other drugs within various areas by using that instrument. There's also the Core Institute surveys, which are shorter in that and tend to focus more on the alcohol and other drug use. There's also not self-report data. There's things available probably on your campus that can help inform what you need to do. So finding out about the alcohol and other drug violations that are happening on or near your campus, either your campus specific ones, or maybe you have local police that can also provide this information. Obviously, medical transports are a very dramatic instance, and so those are often recorded, and understanding when they're most likely, what may precipitate them can be very helpful. You might be using an online intervention on your campus already, or you may be thinking about one, and many of those do have data elements to them. Know that sometimes the validity of those data can be questioned because People are taking it not to answer honestly and anonymously. Often they're doing it as part of some sort of intervention, and that may impact the usefulness of the data. There's also things we call environmental scans, and those are useful just understanding where students are accessing alcohol, what are your what is available to the students and when. You can also be looking at the advertising that's happening on campus or near campus. Are there drink specials that are being pushed or something like that? So knowing what's happening on your campus and the community where your campus or your students are most likely to find themselves is important. If it is a lot of alcohol licenses, for instance, right near your campus, wouldn't be surprising if that's where you're going to want to spend some of your time with your prevention activities. Then there's broader community data available, things that may not be right local to your campus, but can really be helpful in understanding what trends are happening that might be impacting your students. Remember, students are coming from all over the country and the world potentially to your campus. So they're coming with a background that is local to other norms, not necessarily the norms that you have in your community. And so looking at some national or state level data makes some sense in that regard as well. Monitoring the Future is a great survey of both college students, but also understanding what high school seniors are coming to you with for the next year. There's also, your state probably has some nice data that can help you understand things like DUI crashes, and that could be very localized. You can analyze those data often to understand how many alcohol involved crashes are within a mile of your campus, for instance, and that can be powerful in your planning. Then you start looking for your resources. Where can you start building the movement on campus to deploy some programs? One of the things in your toolkit of resources is, in fact, the Drug-Free Schools and Community Act. That requires that every institution of higher education perform a biennial review of their prevention efforts and their policies and policy enforcement. So in the process of creating these reports, you often can enlist allies on your campus to provide data, to provide descriptions of ongoing programs, and to start thinking about what does this evaluation point to towards our next steps in our prevention process on campus. So again, finding those allies. Who are the partners? Sometimes it can be for instance, the Associated Students or the student government. It can often be many departments within your student affairs. It can also be faculty interest within, if you have like public health or psychology or social work. Some faculty on campus have natural academic interests in this topic and can be great in providing expertise on, for instance, assessment on campus or program evaluation, or access to the city or county public health departments or things like that. So start looking more broadly if you don't already have an existing coalition on your campus for prevention. And then finally, I always use patience. And think about the capacity building on your campus. It's very difficult to launch large-scale programs and comprehensive programming on your campus in one semester. You're going to need to build this over time. This is difficult because often campuses have a one-year time cycle, but if you think about your programming this year and think about what you can be doing to build on it next year towards perhaps a more evidence-based approach, or building in an alliance with another department that you didn't have before, to have better access to a certain population. Keep thinking about your programming now as building your capacity for better programming, more comprehensive programming in the future. So these modules hopefully will start filling in some of these pieces that I've just described and give you a starting point for working on your campus to prevent alcohol and other drug misuse, and also build on your capacity to support those students who are in recovery.